If a medication helps you be present, it might be labeled as a painkiller. If it's too much and you're no longer present, it's harming. So that's where some people are on opiates. They say, well, don't take too many opiate pain pills because your bowels will block up and you'll be in a fog, and et cetera. And that's the case for some people. Now, I have 700 people I've prescribed medical marijuana for, and those people are amazing about the miracles they describe, about how more present they are in their lives, because they're not taking opiates or gabapentin that make you foggy. So it's all it's all very complex. No more complex than diabetes or hypertension. You know, what antihypertensive is going to control your blood pressure the best without all the side effects that antihypertensives have? And there's a lot of side effects to negotiate with.
Yeah, but a doc just opens a flow chart and goes down a flow chart on hypertension. He doesn't have that for pain. And I know docs, they're working fast. It's all standard protocol. If it falls outside of standard protocol, then forget about it. You're not going to get help.
Great point. All my colleagues are saying that pain is too complex and we don't understand it well enough and you need to go to a specialist.
Well, they don't know either.
Well, I'm crying bullshit on that because I really, it's no more complex than anything else we learn. And if you said something like that when you applied to medical school, you wouldn't get in. I can't handle the complexity.
Oh my God.
I don't know nothing about prescribing no opiates.
Opiates are one of the oldest forms of drugs around.
And safest.
Narcan.
Probably, yeah.
Yeah, I mean, they're safe. You know, if you don't stop breathing, I mean, that's the ultimate thing. You might stop breathing. But if you don't stop breathing from them, their effects on the body are pretty small, including dependence. I mean, there's a lot of studies that say you put someone who's not addictive and you put them on pain medications, there's like a less than 2% chance they'll become dependent. You know, all this talk is just insanity. Go ahead.
In my case, I have a very addictive personality. Okay, I am a former addict, but it's never on pills because I have a phobia for pills.
Right.
And that fear is so strong, you know. But yet, when I go pick up meds, I'm treated as though I'm flagged. And I've asked at the clinics if I'm flagged. I've outright asked them if I've been flagged, and they tell me no. But I've had I've had a nurse practitioner tell me, go into the appointment and didn't even look at me once. I started telling her my problem, and she said, looked at the computer and said, oh, it already shows here you take narcotics. Not even one look at me, and, you know.
Permission to stop thinking about you.
Yeah,
Really, that's what that is.
yeah,
I experienced something a little bit the same. I mean, the patients I've been seeing are kind of complex, and some of them are kind of demanding and difficult. And I'll be going down to a room to see this patient, and I'm going, I do not know what I'm going to do next. I don't know what to do. It's like, it's confronting as a physician to not know what to do next. But guess what? As soon as I really feel that and overcome the urge to turn around and run, I go into that room with that patient, and something always shows up because I'm willing to be honest that I don't know what the next thing to do is, and that my thought is that if you don't come up with something, the patient's going to come up with something anyway. So listen to the patient.